Clay Johnston, do you want to go ahead with your presentation? And I take it you don't have
Yeah,
slides?
sure. I do not have slides. Yeah. So, so thanks for having me. I'm sorry I'm not there in person, but I've been doing too much traveling and I couldn't squeeze it in. And thank you very much for working on this problem. I think it's a really important one. Um, so I I'll I'll just first give examples from some experiences that I think are useful in thinking about what the barriers are. I think Paula's presentation nicely covers a lot of the broad issues. The one is I was on the I'm a clinical trialist, and so I've been involved in multiple clinical trials and have seen how important it is for the investigators in some instances how, to plan and then do secondary analyses from clinical trials, and having a deeper knowledge of how the trial was done and how the data is organized, how useful that can be in producing more reliable secondary analyses. I was on the cardiovascular health study steering committee for a number of years, and that was an interesting group that struggled with this open versus closed notion. They basically, NHLBI ultimately forced them to make the data sets public, and they did that kicking and screaming. Their take on it was that the value add from their analysts understanding the data and from the members of the sort of core team on the grant and understanding what the data did and did not say was critical to accuracy of reports subsequently. And I'm not convinced either way whether that was the case, but that was certainly their strong belief in the reason that they gave for not really providing any useful data in an open format. Then I think the ADNI, I suspect you all have talked about this, the Alzheimer's Disease Neuroimaging Initiative run by Mike Weiner, is another interesting example. And this is not a clinical trial, it's an observational study, but shows what happens when you completely change standards for data. So in that case, the data were completely open. As soon as the primary investigators involved in data collection saw the data, it was also posted publicly. And that generated a huge amount of interest in the data and a huge number of publications very, very rapidly coming out as the data were posted. Probably in maybe half the publications, the people who understood the data best were invited to be co-authors. But then there were other papers just produced by random groups across the world just accessing the data. It did produce a tremendous amount of activity. It did have the consequence of also, I was in the vice editor for a journal at the time, the Annals of Neurology, and it was hard to know whether the article that we were seeing using that data set was duplicative of another published or being about to be published by a different journal. And there were just so many papers coming out at the same time that the normal guarantees that happen with a similar paper not being considered for publication in another journal, it wasn't enforceable because different author groups were using the data. So it created a kind of really difficult situation from the editor's side, where a bunch of publications now that have come out really are duplicative. Now, ultimately, is it better for society to have these multiple publications out in the public domain, and then we can learn from them? Maybe, probably, but it did create this sort of unintended consequence of greater complexity, confusion, chaos in the publication world. So we, maybe two other examples of attempts that have been made in understanding a bit about their consequences. So one is the CTSI here, the Clinical Translational Science Institute, when I was ahead, funded, along with the California Digital Library, an experiment to see whether we could get our own investigators to share their data voluntarily. And we did it on a platform in which the data were posted and could be easily downloaded. And then it created an easy way to cite the data. So it was sort of like a journal, but without any of the, a data journal, but without any of the, the marketing or even financial arrangements. We underwrote the costs of the platform, and then any investigator who wanted to post the data underwrote the costs of cleaning it up and posting it. That's been up for about a year, and we didn't think that this would, just by putting this up there, it would solve the problem, and in fact it has not. We did encourage through local communications investigators to post here. We're telling them how important it is to share data and let the world know, let the world use it. But we have about 16, I think, data sets posted, and frankly, most of them came from the Mike Weiner, the ADNI principal investigator's lab. So I would say it's not just making a platform available. And again, we knew this, but we wanted to at least create the platform option to help people to get their stuff out there. So then now maybe I'll just very quickly go through some of the things that I think could help to make this happen. One is I think, again, you discussed this issue of the primary team wanting some control over secondary publications. One way, easy way to do that would just be to say, okay, the data becomes available X number of months after publication of the primary paper, and then or after lockdown of the data. But I don't think you couldn't really see that publicly, whereas you can see publicly publication of the primary paper, and then that means the local investigators need to get their act together and figure out what they want to do it quickly before the rest of the public can get it. The second would be if journals recognize that there is actually a benefit to having an insider as a co-author on a paper. Now, I really do believe that. I think the Cardiovascular Health Study Group was right about this. And looking at the ADNI studies as well, you can tell there's a difference in quality when they've included one of the investigators. It just makes sense that a paper is going to be stronger if you have deeper knowledge of the actual data behind it. So if journals recognize that, then that'll help to push up in the priority ranking those papers that involve an original contributor to making the data, and that will help the original contributors recognize that putting it out there publicly, they're actually expanding their base of investigators working with them. Part of that, too, is when data is out there, to create an expectation that whoever's going to use that data should offer to collaborate with the primary investigators of the study. Those two go sort of hand in hand. It may not be a requirement, but it should be certainly strongly encouraged. And then another thing to do would be to think about a system in which we could reduce the costs of publishing. So here I don't mean just posting a data set, but I mean the costs of really for the investigative team, and Paul mentioned this already, it's hard to actually get these data sets cleaned enough and then annotated adequately that somebody could come along and use them. So currently, nobody really pays for that, and there's not much return on that investment. So somehow thinking about how to get that paid for, maybe those people who access the data pay some fee, and some of that comes back to the lab that spent all the energy in getting it clean and posted. But some system to reduce that barrier for investigators to put it up there. And then finally, somehow we need to incentivize publication of data sets or posting of data sets. And then obviously you all have been talking about this. The one is that if it's actually treated as an independent citable reference, one could, if it's considered an important piece of scholarly work, just like another publication, then one could imagine that this would be an extremely valuable publication for someone like the person responsible for the data, whether it's the statistician or chief coordinator, or whoever you make responsible for that, and then that becomes a first author publication for them, and then is cited when that data set is used. And so I know there has been discussion about creating data journals that could handle this stuff, and I honestly I think that could be useful in thinking about creating the system too that would also recognize costs and the distribution and give some sense too of the sort of stature of data sets, so that the typical academic capital of publications is reinforced and embraced in data sets as well. So that was a quick survey of lots of stuff, but I think obviously this is designed as a panel, so the discussion hopefully we can go through the things that will be most useful to the committee.
Okay, thanks very much. Questions from the panelists, from the committee, I'm sorry. Steve Goodman?